Hello everyone, it's Dr. Gupta, dermatologist at the Dermatology Laser and Vein Center, and I was going to touch on the topic of baby Botox. This is not Botox for babies. This is Botox for younger patients, usually in their 20s, who are trying to prevent getting wrinkles in the future. Either they are seeing a lot of movement in themselves, or they see that their parents have certain wrinkles and they might be prone to those movements and wrinkles as well and want to prevent that, but they want to get a smaller amount, either because they want to spend less or they just want a smaller quantity because their movements are not so exaggerated yet. That is certainly a very good idea in patients who do have a lot of exaggerated movements and want to prevent wrinkles. My only thought on that is that you should really get the amount that is required to make a good improvement. Otherwise, just don't do it. There has been some data potentially floating out there that if you get a very small amount of Botox very frequently, that it could potentially lead to resistance. We have really not seen Botox resistance very often in the last 24 years that I've been practicing. I think I have had 2 patients who somehow became resistant to Botox, but because of the small fear of smaller, more frequent quantities causing resistance, I would urge you to not get it as frequently, even if you do get smaller quantities, and always get the right amount that makes sense for your situation.